great. So I know most of you have been here before. So I'm glad you came tonight. Tonight we're going to be more like a practical workshop. We're going to kind of give you some information about how you might be able to help yourself when you're at home, and do give you some acupressure points to work on for all kinds of ailments. I'm going to show you a little bit of reflexology, a little bit of ear acupuncture that you can use with pressure, with using points on your fingers to work on these things. So I'm glad you brought a partner. If you didn't bring a partner, then we'll do what we can do.
You didn't? Sorry. Oh.
Okay. So you three guys can work together. All right. So we're going to talk about acupressure therapy, trigger point therapy, same type of thing. It's a lot of people use the idea of trigger points. Well, it's the same idea. Trigger point therapy was all based on acupuncture theory, acupressure, but it was a little bit of a foreign term for people to kind of wrap their heads around back in the 70s. So the term trigger point was used. So we're going to first show you how to find these trigger points, and after we find them, what are you going to do with them? What is a trigger point? What is an acupressure point? It's a point that indicates that you have some muscular spasm, because you can feel these trigger points on the surface of your body. And if you're feeling it on the surface of the body, it's there for a reason. And we know that sometimes the locations of those tightnesses, the muscle spasms, can be because of imbalances in the internal organs that are associated with the areas that are showing up on the human body. And you'll see that when we come to some of the acupuncture charts. And what are these things? They originate because of the reason that every other pathological event happens in our life. Energy stagnation, blood stagnation, or organ imbalance. So that's going to cause you to have these spasms. There's an empty chair right there, and you're just the person we need, because it's perfect now. Everybody has a partner.
Thank you for saying that.
Okay, so here's an acupuncture chart. If you haven't seen an acupuncture chart before, you see these lines going up and down the body, down the arms, the legs, from the feet all the way up to the inside corner of the eye, to the top of the head, the tips of the fingers, tips of the toes. They look like they're all separate lines, but acupuncture meridians are actually a continuous flow from one meridian into the next meridian. There isn't any break in the flow of the energy in the body, going from one organ into another organ system. It just flows from one organ into the next organ system. So let me give you an example. The end of the lung, the meridian that's associated with the lung, it finishes over here at the end of the thumb. Well, the next one that picks up is the large intestine, which goes up this way here, all the way up to the top here, and that goes all the way up over to the side over here, and then it picks up the stomach meridian over here, and that goes all the way down the body here, down to the end of the second toe, and it switches over to the big toe and comes all the way up the body on the inside of the body, up over to here, and you get the idea of this continuous circuit of energy that goes and flows in the body. And so we can have a problem with the stagnation, blockage of the flow of the energy. And a place where energy has a tendency to get blocked a lot of times is at the end points. When they're starting to flow over into the next meridian. And so that's a place where you can make a lot of changes in somebody's physiology by working on the acupressure points below the elbows and below the knees. You can make a lot of difference in people. So all of these pathways, these meridians, are associated with different organs, like the lungs, the large intestine, the stomach, the spleen, the heart, small intestine, the liver, the gallbladder, kidneys, and bladder. Okay. And we talked about the ear. If you look at the ear, the ear kind of looks like a fetus turned upside down, right?
Never thought of it that way.
Yeah, isn't it? Yeah. So all the points that are associated with the head, that's kind of like the way a lot of, profound things have come about. Gee, it kind of looks like a fetus, huh? I wonder if I pressed on these points over here, what would happen if somebody was having a headache and I found some tender spots over here on this earlobe and they went away. So a lot of it is trial and error. These aha moments that people come to sometimes. So if you look at the ear, and you think of the points over here on the earlobe, the points that are associated with the head and the brain and the eyes and the ears and the sense organs. And the neck is over here. Spinal column goes down here like this. The feet go up into this area over here. Shoulders, arms are over in this area here. All the internal organs are in here. So it's like a map of the whole body. You can stimulate the different parts of the body by stimulating the appropriate points in the ear. I know some acupuncturists, that's all they do for everything. They just treat ear points for everything. You can do that. I just get bored to death looking at people's ears all day long. But if you think about how profound this is, whatever your perspective is, God made you, whatever God is to you, he or she didn't reach in the ear box and stick on an ear, reach in the nose box and stick on a nose. You got made as an integrated whole, and every part of you is actually interconnected with every other part of you. So we actually have ear acupuncture, nose acupuncture, scalp acupuncture, hand acupuncture, foot acupuncture, and there's a map of the whole body in each one of those areas. So when you know what the maps are, then you can affect those different parts of the body by stimulating the points in the ear. When I was in China treating people for strokes, after effects of strokes, all we treated was scalp points, and there's a map of the whole body on the top of the scalp here, and that's all we treated was people. We treated all these people that came in with strokes with scalp points, and I saw people getting up out of wheelchairs in a couple days after treatment, and so it can be really profound. I had one patient that came before I even went to China to do that training. So somebody came in and she was a 51-year-old woman. She was, young woman. And she walks in, she's like this, she had a stroke. She's got one of these 4-pronged canes, and she's walking like this, dragging her foot. And I think it was right in this room. I just put her in the chair and I sat her down, and I just felt so bad for her. And I put a needle in her scalp, and about 15 seconds after I put the needle in her scalp, her hand opens up like that. Yeah, it was unbelievable. So I said, "Come on in here." So I brought her into the room, I put her on the table, and she's laying on the table, and for me it's important what part of the body you're having a problem. She said, "I'm having some problem with my other." I kept stimulating the needle, and so her hand goes down by the side here. She said, "My other arms are having a problem too," and so it's important for me. Is it on the inside or the outside of the arm? I said, "Well, whereabouts in the arm?" She said, "It's right here."
Wow.
So, you can make a profound difference. Some of the things that I want to show you don't minimize what you can actually do with these things. One of my Kung Fu brothers, 100 years ago in Boston, we're in class, and he gets this horrible headache, 50 years ago. Horrible headache, and so he says, "Look, I got to go to the hospital." So a bunch of us piled him into the car, and we're driving down the Southeast Expressway in Boston. Jack knows all about that. this big, highway over the streets, ugly thing, it's gone now, finally. But anyway, we went down to the New England Medical Center, and 6 of us walk in there with Paul, all dressed in black, kung fu uniforms and sashes, like we're ninjas or something. And we walked into the emergency room.
Good price. Oh, Jesus. They go like this?
That's right. So they gave, they gave us the intake sheet to Paul, and we're making out the intake sheets. Like, this is way before I was into acupuncture, and so that was back around 74, 75. I didn't go to acupuncture school till '83. So about 74, 75. That's when it was. So anyway. I said, Paul, give me a foot. Let me see if I can help you here. So I took his foot and I rubbed some points on his toe, his big toe, while we were waiting in the waiting room. The headache went away, gone, and didn't come back. So you can really make some changes with these things you're going to learn here tonight. So, and we'll probably use your foot because you've got nice, easy shoes to take off. So I'll use you as an example. So, okay, so you got the idea here, right? And so same idea here. You can see the map here, corresponding to different organ points in the body. Okay, so here's a foot reflexology chart. So, well.
I'm too ticklish.
Okay, come on up.
Yeah, sure.
All right, see right there. Let's see. So, you guys see? All right. Laurie? Laurie?
Terry.
Terry, okay, Terry, thank you. Okay, so here we have this beautiful foot, and you can see it kind of looks like a human body, doesn't it? Okay, let's look at it. Let's look at it this way, okay? This is the head. Now this is the area that I was working on with Paul. The little limited knowledge that I had of foot reflexology at the time, I was able to make this headache go away that was strong enough for this guy to feel like he needed to go to the hospital. So if Terry's got a headache on the left side of her head, then I'm gonna search around for points over here on this left side of her toe. You see this one, Terry? If I was going to use this foot, then I would look for points on the left side of this toe. Left side of this toe, left side of that head. Left side of this toe, left side of the head, okay? Top of the head, top of the head. So, and what you'll do is you use the corner of your thumb and you search around and you'll find, and I can't kind of show you what pressure I'm using on Terry's foot, but it's pretty good pressure you're going to use. You're not going to just kind of press around on it. You're going to like really grab it and search. You're going to search with the corner of your thumb, and you'll find what the person will tell you. Oh my God, it feels like pieces of glass. It's going to feel like a really sharp sensation. Like not like a little pressure sensation. It's going to feel sharp like pieces of glass. That's the point, and you can stay on that point, and you're going to use as much pressure as the person you're working on is able to tolerate. I'll let you know, oh, wait a minute, that's too tight, too much. You back off on the pressure a little. So you find the tolerance level. But when you find that sort of spot where it's like little sharp pieces of glass, you want to think of it as what it is. It's little crystal deposits in there that you want to try and grind those things away. You're trying to grind them away. And the more relief that the person starts to get over here, the more relief they're going to get from whatever that problem is corresponding to that part of the body. So if this is the head, then this must be the neck, huh? Right around the big toe? Okay. And so you can, somebody's got a stiff neck, you can really help it by, rotating the big toe around, playing with the joints, a little bit back and forth, and then also feeling around and, excuse me. But, and I didn't press that hard, but you could feel a difference. I mean, I was pressing pretty good up in here. It wasn't such a big deal, but when I pressed down here, you could feel something different there, right? It feel like a little sharp type of sensation. And that's what you want to look for. And so you have to use your sensitivity and listen to this person that's, you know, that you're working on, because you don't want to be, you know, making them be suffering. And you just explore all around. So what you would want to do is stay on that spot and work on it as much as you can. And you can see I'm not pressing on it too hard, so that indicates, you know, there's some stuff going on with your neck. Okay. Now, this line here, you see the flat line here where my hand is, and this line here where they kind of meet like that, right in this point where the red skin and the white skin meet. Well, that's the spinal column. Okay. So if your neck is up here, you can think all along here. Okay, this is the thoracic vertebrae, is right down to the T1, C7, T1, and the thoracic area, and the lumbar area, and the sacral area in here. So you can work on the whole spinal column. Now, the nice thing about working on the spinal column all by itself, just working on, if you don't know where all the other zones are on the feet, if you just work on the spinal column, you're also going to be helping any of the internal organs, because when I work on somebody's points on their back, I'm not just working on it because of the points, you know, a problem with the back, but I also know that there are organ points that are associated with those points right along the spine that make a direct connection with the lungs and the heart and the pericardium and the liver and the gallbladder and the spleen and the stomach and the kidneys and the large intestine, small intestine. And you can stimulate those points right along the spine. Well, you can do those physically on the spine itself, or you can do that same thing right here. This is the spinal column. And if it's a spinal column, it's also, you see, you get the picture. This is an integrated whole. Every part of you is interconnected with every other part of you. You should be able to fix anything that's going wrong with you in one part by stimulating appropriate points in another part of you that are associated.
Both feet?
I would.
Both feet?
Yeah. And as I was telling Edna and Glenn, if you're you're a couple and you're with your partner, and one of you puts your head down one end of the bed, and the other one puts the head up at the other end of the bed, and you do each other's feet at the same time. You fall asleep like babies. The sinus, you owe me, man.
Wait.
These points in the middle of the pads here, those are points that are associated with the sinuses. Okay, so you can, you find little tender spots up there, and there's little sharp sensations, and you work on it. It can really help the sinuses. Points that are associated with the ears. See the pinky toe and the ring toe? the point right in between those two toes and the next toe over, those are associated with the ears. And the other ones, this one here in between the index and middle toe, and the big toe and the ring and the index toe, those are associated with the eyes. So you got 5 toes, and you got 4 spaces in between. The 2 outer spaces between the toes are associated with the ears. The 2 inner spaces on the toes are associated with the eyes. Follow that, what I'm saying, the spaces? Okay. You got the toes and you got the spaces. Okay. So the first 2 outside spaces are the ears, and the 2 inside spaces are the eyes. So that's good. So what I would like you to do when you you know, you learn something here that's really helpful. As far as the reflexology part of it goes, go down to the bookstore and just pick up a reflexology book. They have some beautiful textbooks. This is a lousy picture, I wasn't able to find something a little bit more clear. But there's some beautiful textbooks in the glossy color, photo, reflexology books that are out there, and they're really good. And they're chock full of information, and they'll give you point prescriptions to be able to use for whatever kind of problem you got going on. And what you're gonna look for is, and when I come around and help you with trigger points, I can show you the kind of pressure that I'm gonna be, I would use to locate those points on your toes. So it's pretty good pressure. Now, I didn't have to use a lot of pressure with Terry because that just happened to be a tender spot for her, and that's what you're gonna have to pay attention. When you do your searching, you're gonna have a certain pressure that you use, but you have to be sensitive that you're using that same pressure and the person goes, ah, you gotta immediately back off a little bit, okay? And then you run to your foot reflexology book and you say, oh, that's associated with this. You're having a brain malfunction.
Yeah.
Okay. So, let me see. So, what I want to get to is give you some useful things you're going to start working on each other. Are you with us?
Yeah, what, me? Yeah, my dad.
Oh, Diane.
Oh, Diane's,
Diane.
yeah, I don't know,
Oh,
are you
yeah.
checking your pulse?
No, I'm doing my, adrenal.
Okay. Oh, did you have something to eat?
No, just 'cause I should. It reminded me.
Well, you can, when she's talking about sometimes you're gonna test your adrenal glands if you take your pulse rate and just count how many beats you get in a minute. And then eat something you might be suspecting you might be allergic to. And then feel your pulse again. And you wanna feel it, right afterwards, maybe a minute afterwards, maybe 10 minutes afterwards. If you find that there's an increase of more than 10 beats per minute, then you're probably allergic to that thing you just ate.
No, I was taught that this is the trigger point for my adrenal gland.
Oh, okay. On the left hand, not so much on the adrenal, not on that point. But we'll talk about that later. So we got stress restricts the flow of the energy in the blood in the body, going through those pathways, causing a muscle spasm. That's what we're looking at as a trigger point. And creates more stagnation and pathways causing more tension. It gets to be this vicious cycle. Muscle tension causes pain, pain causes anxiety, anxiety causes muscle tension causes pain. You get this cycle, this vicious cycle that keeps on running around. And you have to break that cycle someplace. So trigger point acupressure is a really good place to be able to try and break that cycle sometimes, to get the muscles to relax so you don't have to keep on turning the muscle tension into pain, and then the pain causes anxiety. If you can break the cycle someplace, it's a good thing. So in Chinese medicine, we call these, they're not trigger points, they're not acupuncture points, they're Ashur points. We call them Ashur points. That's a technical Chinese name for a trigger point. And there is an actual form of acupuncture that treats Ashur points. You just take the point. If somebody's having a problem, you needle that point. Simple, huh? It's a low form of acupuncture, but it's a form some people use, and it can be very helpful sometimes. And sometimes really help to release that spasm. So, Ashur point, probably because, if you press on the Ashur point, somebody will go, Ash! Okay, so this is what we talked about. Stress keeps running around and around. Okay. So, anybody know this guy? You think he might have some trigger points? Okay, so let's take a look at some of these things, okay? Now, these things are in your little notebooks there. These are yours to take home, okay? These little trigger point charts here, they're in your folders. Okay, those are yours to keep. Just to give you some reference. So let's look at some of these points, okay? So, see these points here on the back of the head? And this number 1 point here? Let me show you those first, okay? So, I'm gonna use me. So, here's the middle of the head here, and over the side. So you want to go about 3/4 of the way. You know, not here, but about halfway, and then just fall off the bone into a little hollow spot there. That's the point. That's called gallbladder. That's called gallbladder 30 in this area here. Okay. This is gallbladder 20. Gallbladder 30 is down here. Sorry. So this is gallbladder 20 up here. So it can be associated with the gallbladder point. Now, when you work in these points, this is a really important point. You want to not be having pressure on your arms here, because you're going to be using neck muscles here if you're working on these points up here with your arms up here like this, right? So here's how you do it. You do it like this. This goes and works on that. That way you can relax this one over here, and you press on this. And then you want to work on the other side. Then you go over this side. Fall off this way here. Now there's another one that's associated also with the gallbladder. That's number 21. And that's up here, right at the top. That's called the master stress point, right? So here's how you find that one. You grab the shoulder with the ring, the middle and thumb finger, okay? And your index finger goes right on the bunch, right on the top of the bunch there. And you would press on that. Now, this is an interesting point. So I'm going to have you just press on this and pay attention. You'll feel a little sensation running up the side of your head. If you feel that little sensation going up the side of your head, you're on the spot. Because the gallbladder meridian, pathway that supplies the gallbladder, starts here on the outside corner of the eye, and it goes over here, and then it goes up around here, over here, zigzags across the side of the head, goes down here like that, goes down here, all the way down the side of your body, all the way down to the fourth toe. So if you press on this point here, you'll feel a sensation traveling up that gallbladder meridian. It's a really great point for migraine headaches that are on this. Most of the time migraine headaches are on one side of the head or the other side of the head. So work on the side of the head that you're having the migraine. And again, you bunch up the muscle here, you put the finger right in the center of it, and that's where it is, and you just press on that spot. And I can feel it, go right around my ear here. And you do the other side the other way. You work on one side, and you do the other side this way. Now, there's another beautiful spot that you can use. And this one, the way you do this one, is you take your fingers and put them together like this, so they kind of braced against each other like that. Like that. And you take and put it right in the center of the center line on your head, and you fall down into the little hole. Now that way, what you're gonna do, this is the way you would do this one here. You got the fingers here, and you just lay down on your back. You lay down on your back, and you just relax. So you get the idea. You're not going to be going like this. Like you're not going to be trying to push this point. You're just going to let the weight of your head let your fingers that are braced like that so they're not going to bend, and you'll be able to apply some pressure to that center. You know, that point right there in the center will relax this whole area here. Beautiful point. And then here's some of these points along the spine here. Now these points along the spine are in the spaces between the spine. Let me see if I have a little. Okay, so here's your spine here. You know, when you run your hand down the center of somebody's back and you feel the bumps there, that's what you're feeling, these bumps here. This part of your spine here is, you know, towards the chest over here, and here's your backbone right there. Well, these points are located, these points here are located in the spaces. So you find a bone, and you fall off into a little hollow space right here. And then about, you know, an inch or half inch or inch and a half to the side of that, the empty space, that's where these points are. And which ones are you going to do? Well, you're going to do the ones that are tender for that person. The person feels tender at that spot. That's an indication, that's an sure point. If there's a muscle knot there, if there's some spasm there, so you're going to use your fingers, you're going to educate you about something that might be going on with this person. And they're going to let you know, well, that's tender, I feel that really sore there. You don't have to know what organ it belongs to. If you have one of your little foot reflexology books, then it'll, you know, massage therapy books, then they give you that information in there. Okay, but you can think about it as, you know, these points up here are associated with the heart and the lungs, and then a little further down it's the liver and the gallbladder, and then further down it's the stomach and the stomach and the spleen, and then the kidneys and the bladder, and the large intestine and the small intestine. So you get the idea. Around the same level, you're kind of taking care of the organ that might be around the same level. So if you have some you know, wondering about whether or not my liver is okay, well, you know the liver's not down here, right? The liver's not up here, it's someplace in here, so you just play around and feel and see if you have any tender spots in this area, or the person that's working with you. See if they find any tender spots in those areas, and you can put a little dot there, and you know, have fun trying to find out where those places are.
What about those spots right there by the, is it the latissimus dorsi?
Yeah, those are points in between the ribs, and you'll trace the ribs. The ribs kind of go from here down here like that.
Mm-hmm.
So this point here is actually associated with a point that's up a little bit higher than that one over here. And the gallbladder meridian goes right down the side of the body. Goes right down the side like that. Gallbladder meridian is probably the most extensive. It makes an excursion through the widest terrain in the body, the gallbladder meridian. Okay, so here's some points on the head. These points are really great. You can use. Let's look at the points that are right around the skull here, okay? So you know where the hollow spot is, right? Where your temple is. Okay, so you find the little hollow spot there. Okay, what you want to do is just move your finger in any direction until you feel the bone. Okay, so what you're going to do, you're going to start someplace, so you can just take that spot and rub the bone there, and then go around, because you know there's a little circle that goes around here like that, right? If you got the hollow spot here, if there's a hollow spot here, then there's got to be bone towards all the sides if it's a circular hollow spot. So you find the bone, come out from the hollow spot, find the bone, and then just start going around the perimeter of the hollow spot. And you'll find little sore spots there. especially if you're having a headache, you'll find sore spots there. And if you find a tender spot, a sore spot, you want to stay there, spend some time there working on it. A really great way to work on your partner on this is your partner, okay, here's the bed, or here's the floor, and your partner's feet are down there, and your head's here, and you just kind of spread your legs here, and you can hold their head right here. This is a really great position to work on somebody's head, because they're just lying there, and your hands are here. You can find this whole area here really, really nicely. You can work on the back of it over here. You can work on the forehead. It's a great position to work on somebody's head. They're lying on their back, and you're sitting, at their head, and working on it that way. It's a great place to do it. So you continue all the way around, and you just keep on feeling the perimeter of the hollow spot, the temple hollow spot. And wherever you feel it tender, you spend some time and hang out with it and work on it, okay? There's a really, so these are really good ones here too. And take your thumbs like this, and so I'm going to put this part of my thumb on underneath my eyebrow, underneath the brow of the bone, in the eye pit. You can rub that way there. Yeah, you can't do it with glasses. Yeah, try it. Thumbs like that. And stick the knuckle here underneath the bone. Yep, on the inside there.
Yep.
Yeah, and then just kind of move it to the side. Yeah, that's it. Okay, here, bend your thumb here, and just put it underneath the bone here, and then you roll across that way there. Yeah, she can only do one. Try it. Yeah. So you're using it this way because you don't want to be poking your eyeballs, right? So you want the pressure with this is up with your thumbs. You're not pressing in like this, you're pressing up. Yeah. Up under the ridge. And you go that way, you can just go along the ridge. So let's go to the next space on that, okay? If you get to here, pushing up with this part of my thumb, right? And then I get to the end, well, I can go over to the lower lid now, can't I? Actually, it's easier to rub these from the inside to the outside. So you take this part, okay, you use this part on the upper one, you're going to use this part on the lower one. And you start, and you're pushing down, not pushing into your eye, you're pushing down. And go along the eye, the bony eye socket. And you do that a few times.
And that's for a headache?
That can be for an eye headache, yeah. It's also really, if your eyes are really tense, you've been reading, you're sore, this is a really nice exercise to do. And you can do as much as you like. You got these little spots right here on your eyebrow. If you go on your eyebrow here with your finger, and just go laterally along the eye, and you're gonna find a spot where there's a little vertical cleft. It's almost like you're going along in your eyebrow, and then there's a little dip, a little valley there. That point's called Yu-Yao. Yu-Yao means fish loin. That's your fish loin. But it's a very good point for eye problems. So you can find that little crevice, right? Find a little crevice. It's about halfway. It's about halfway over the eyebrow, maybe a little bit more, a little bit less, but it's about halfway into the eye, and you'll feel this very clear vertical cleft right on the eyebrow. That's too far lateral, Jack.
Yeah.
That's a little bit right there, yeah. A little bit. Are you in a little valley there? You feel a little valley? Huh? No? That's okay. No, that's too far inside, Jack. Let me show you. Okay, yours is right there. Feel that little valley right
Yeah,
there?
I can feel that, okay. Right in
Yeah,
here?
feel it?
Yeah,
Feel where I was?
yeah,
Can you feel like I'm in a little valley there?
right there.
Yep, that's it. Okay. Fine? Yes.
Just for headaches?
Yeah, that's really for headaches. You guys clear up, can you feel that little cleft there? No? This is your workshop, so you're not, I want you guys to walk out of here being able to use some of this stuff. So you feel how my fingers on it will, just rub from side to side a little bit, and you'll feel a little order.
If I fluid things to the water, it's all.
It feels like with the eyebrow, I'm not an artist, believe me. So here's the eyebrow, right? Just happy to see you.
Banana and orange.
Okay. The cleft is, and it's like a little, it's a vertical hole. So that if I came in, I'm going from the inside of the eye and I hit this point here, it's like there's a little valley. My thumb kind of goes into a little dip. There's a little dip in the bone right there. Yeah? You see? Yeah, right there. See, now yours is a little bit more medial than other
Yeah.
people.
Yeah, and then it goes up.
There's yours right there. That's for any kind of problems with the eyes. You can press on that point. Did you find it?
Dry eyes or anything?
You got it?
No. Have to work on it.
Any difference in texture there? Right there.
Oh, okay, I see that.
And that's all it takes for you to just, you feel it and you'll have it. You got it, Tara?
What can that affect in the eye?
Any kind of eye problems.
How serious?
I don't know.
Dry
Whatever. If you've got something going on with the eyes. I mean, I'm not gonna give you these points and tell you you can make the blind come to see.
Well, is it gonna,
I don't
will
know.
it treat macular degeneration, something like
Can,
that, or?
sure, people, we have all our problems because we have a lack of circulation getting to a particular part of the body, so anything you can do to bring circulation to that part of the body allows you to bring life force, energy to that area to do whatever it can do. If somebody's too far gone in anything, and you only have a certain capacity to be able to, in other words, if you have tissue that's damaged enough so that tissue's dead and it's not coming back, then there's only a certain amount of recuperation you're going to get, right? So, all you have to know is that you can't do anything bad by pressing on those points.
Feels really good.
Yeah, it's really great points. Okay. Anything else? So let's try and let's do this. And you can work on these. You can work on these points at home. Okay. This can be helpful. Here's the knee point here, and here's the butt fold here. You can press on these points right on the belly of the muscle here, and it can help to loosen up that whole muscle. You can just take this point here and this point here and press on those points at the extremities. So if you had, you put your finger right where the crease is on the butt and hold that point here, and this point here, right where the joint of the muscle is here, and press on those points. That can help anything in between here. Okay, so if you've got a problem in the hamstring, it can be helpful to hold on to this point here where the butt crack crease is, and where the ankle crease, the knee crease is, and press on both of those points, and that can loosen up everything in between.
What about your sciatic nerve?
Sciatic nerve,
Number two.
yeah, this point over here would be a good point to use. And the way you would find this point is,
Carry your wallet back
if you carry your wallet back there, you're gonna get sciatica.
there.
You carry your wallet back here, you're sitting down here like this all day long, you're walking around like this all day. Okay, I'm exaggerating, but it's not so far-fetched, is it? I mean, if you're sitting down all the time, you're sitting down and you're up here like that because you're on your wallet, it's gonna throw you off, you know? Cab driver sitting on a wallet all day. Okay, so you can find this point here. If you looked at where does the top of the crease in your butt come, and where's this bone over here, the bone that sticks out, your greater trochanter. Okay, there's a bone. It's not up on your hip, it's not on your leg, but it's right on the side here. There's a bone that, if you can feel that big bone sticking out right there. So between this point and this point here, 1/3 of the distance up to that point, that's where this point is here. And it's usually a little hollow spot right to the side of the butt cheek, right to the side of the gluteus muscle. And it'll be tender. There's a really good muscle. There's a really good stretch that you guys can do for each other too. If you have sciatic pain, I think I'm gonna have to use you for this, Jack.
Okay.
All right, you'll see what. Come on over here, Jack. Why don't you lie on your back on the floor here, Jack?
Easier said than done.
We'll help you.
All right.
So here's how you do this one, okay? So I'm gonna bend your knee, Jack.
Yeah.
Well, let me just ask you, you got anything going on the left side or the right side?
It's all on the right.
All on the right?
All on the
Okay,
right.
great. So let's see if we can do something with this. So I'm gonna take and put this over on the other side. You watching, Diane?
I'm watching.
Okay, so you lock this person's leg over on the other side here, right? And you take your knee and kind of lock that foot in here like that. Okay, so he can't move his foot. I'm going to take this hand, my left hand here on his right in the crease here. I'm going to kind of knife edge the crease here. And my arm here is going to go on the outside of his knee here. And I can just kind of brace here. And then I push this way here. I push my elbow this way here. And this is just to kind of hold it stable so Jack's not lifting his hip off the table, off the ground. Okay, now what you want to do is, and you're going to let me know. If it's too much, then you let me know, I can back up. But what you want to do, when I get there, you're going to use pressure and push against my arm. Push against my arm.
This?
Yeah, push my arm that way. That's it. Good. Okay. And then relax. And then just relax. And then push it some more. And relax. Okay, relax. And then try and get a little bit more stretch.
Yep.
And then you can push some more. Okay, like that. Okay, and then relax. Okay, so that's a really great stretch for you to do for somebody that's got a sciatic problem. Okay?
How do you do it yourself?
I can't. Yeah, that's why you
Pick it up.
Yeah.
I got a bad shoulder too or something.
Yeah, but the shoulder's so much better.
All out
He
of
was
it.
so impressed. After the one visit, he was like, oh my God, I can't believe how good my shoulder feels. And he can actually feel in his hand again that he
Oh,
couldn't
that's beautiful.
before.
That's nice. Yeah, so, you know, I teach the workshop here, so that, you know, even if you don't have somebody you can do it with right now, you know, you gotta have a friend someplace and you can have help you out sometimes. So I just wanna show you something that you can do that can help the sciatic nerve. If you don't have anybody to do that, then you know, you use your muscle, you use your fist, your knuckles, and there's some really helpful, I just happen to have great thumbs for pressing. My Japanese acupuncture teacher used to tell her, she'd stop the class and she'd, well, look at this.
You put cheese on those.
They always been like
You
that.
played
Yeah.
those before?
Were you born like that?
Yeah, I was going like that. So, but you can take, you know, this is called a ginger fist, and this is you know, this is a part of where I came from, the martial art tradition. But this is a very helpful fist. If you take this middle finger here and you lock it into these two fingers here, and then lock that, you've got a really stable thing to be able to press this knuckle into trigger points and pressure points. The middle knuckle. It's called a ginger fist. So you just take it like that, and it folds like that. You guys are gonna kick butt, aren't you? Okay. So let's work on some of these trigger points up here so we can, you guys can feel and find out what these things feel like, okay? So we got a couple of rules on this. You know, you're gonna raise your hand if you have a problem. You're gonna start pressing at this point if there's pain, and you're gonna hold the pressure point until it becomes less painful, not until it's gone. I'm not even gonna go that far. All I wanna do right now first is just help you to locate these pressure points, these trigger points, these acupressure points. I just want to help you to locate them so you feel what they feel like, okay? Now, when you're at home by yourselves, what's really, really helpful in being able to build your sensitivity to be able to feel the trigger points, the acupressure points, is to spread some oil on the skin. Oil on the skin is going to make it so much more palpable as far as being able to find the ridges and the bumps in the skin. It's easier if you're letting your finger roll over some oil, so it's a really good way to do it, okay? So, let's see. Can I use your shoulder for a minute since it's wide open? Okay. Okay, no, you're okay then. So we're gonna locate. So what I'm gonna do is I'm gonna just kind of, you know, Diane is got some pretty. I mean, I don't have to press very hard at all with Diane. She's got some pretty good trigger points in this area here. Now, a trigger point is gonna feel like when I come along here on this point here, right here. What I feel when my finger goes over that thing is I'm gonna exaggerate. My finger feels like I'm going along nice smooth skin, and then whoop. Big bump. Now that's an exaggeration, but when I push my finger across here on Diane's bump here, that's what I feel. I feel smooth, whoop-de-doo, and comes back down again. And that's going to be a tender spot. That's going to be a trigger point. If I press on that, it would be tender for her. So that's what I want you to do. I want you to just kind of press lightly first and just kind of, so I want you two work together so you two can work together. You got a good left hand. You're not working out on us here.
So you use a couple of times. I have.
Work on each other. Okay?
Can you press on that spot?
You're not going to do any pressing. We're finding
Oh,
right
just
now.
signing them?
That's
Yeah.
right there. There's a hole in it.
I think
There's
this
points like this.
So we go across the top of it.
Yeah, that one there.
So you wanna
Try to find it.
No, it's just.
Yeah.
So, you could do it.
Yeah, just fix the chairs, and this is perfect, you know, when they got the
Fix
chairs
this.
with.
I'm looking for a bump.
Huh? I mean, there's the pressure points.
Do you want to turn? Or do you want
So
me to turn it?
what is that?
You want me?
Yeah, I'll find the money.
That works right there?
My shoulder, right on my foot. See if I can feel it.
It's kind of like a hard spot.
His finger, I can feel his finger because of the pressure in his hand.
Yeah, right here. But press until you, but now you find
Yeah,
this.
you're on it.
Yeah, now go over that spot, and you
Yeah.
feel a difference in the texture.
Does it hurt anywhere in particular?
Okay, so you find a spot?
I get better pressure now.
So, all right, good, so we're just locating right now, and then we're gonna work on what to, we're gonna work on what to do with it after you find it first.
Find
I
it?
think you found one here. Well, you don't feel anything.
Is that too hard?
No.
You don't feel anything, okay.
I mean, no abnormal.
Much better.
Okay.
I can do this all day long.
But this isn't about what Jack feels, it's about what you feel.
I feel it.
So good.
Feel better?
So he's one right
I
here.
can feel that.
People get too.
So come along here, and you'll feel like it's a little bump right there.
That'd be the same on the other side, right?
Yeah.
Yeah, so wait, that's supposed to have this side?
Yeah, your pressure's much better. It's like his now.
Try it on this side and see if I can feel it.
That's better, see. If I-
Yeah, yeah.
If I do the finger thing.
Yeah, but what's that supposed to fix?
Well,
Where you feeling?
You have to press really hard for me.
To loosen the muscles, you mean?
yeah.
Everything's so stiff there.
There, right?
Be true.
Yeah, well, you hit it a little while ago. Right there. That's different.
Right here, this one right here.
Yeah, so go, you know, you can go a little bit deeper if you need to, if you feel it's hard.
Yeah,
There's one here.
usually
Is that supposed to be loosening my muscles?
You got it. Can you feel it? Can you
So
feel
that-
the crystal or whatever?
My tingling should go away.
I really feel like a crystal.
Yeah.
Try it on this
There's
side.
something, yeah. You can call it
Wherever we
anything
find,
awful.
find one.
It's dense or something.
Yeah. Kind of hard.
Yeah, I feel a little bit, but not much.
Hard to feel muscles on it, just tightens up.
Yeah.
Or it gets bunched up.
And use those what's on the feet, you know, the spinal column.
Yeah.
I work on trying to relax all
Find some spots
my
on
muscles.
the exercise.
Doesn't always work out that way.
Calm down.
Yes, you're getting better and better every second.
That right there is a bone. Right over here, you can feel down where my finger is here, going right there. It changes the texture there. Yeah, that's a bone. So you feel the little muscle spasms, the little pieces of tight muscle. Okay. Yeah.
To try both.
So it's more like, I guess.
Yeah, she found it.
Great.
Maybe you got
Okay.
better.
So you want to switch?
Maybe everything feels.
You might have.
Well, we tried. Can I use my thigh?
Yeah,
sure. went to the initial 15-minute free.
Did I?
I guess we all have that. It's like tense up.
I feel like it. I just got this information, 4 tears in there. So does that affect the tear?
It's amazing how much tension.
You feel all over it, not as much as that hole you hit over there. Well, it moves.
So,
It's like he's got a lot.
so you can press on this spot here. All right, so let Jack find one you know. Because I want to just show you guys how to locate these things, so. So after we locate them, then I'm gonna show you what to do with them after we find them, okay? But I just want you to work on locating them first, right?
We got.
You hear?
I think that's a ball.
It's in between everything.
Yeah. That's a little hole, you're looking for a bump.
Oh, bam. So you have it.
Try and feel for the difference. Feel for the difference there, yeah. And you're gonna see a major difference. You go use some oil on there, and you're gonna pass your thumbs over there, and you say, wow, you really feel it.
This is, right there.
Yeah.
You feel it, it's a little bit different in the texture. Okay, great. Okay, so let's look at, your partner left you? Oh, no. Okay, so we found the trigger points, so let's do something with them now, okay? So what you want to do is, when you find the trigger point, you're going to use some pressure on it. And you're just going to use steady pressure. I want to show you what to do first, okay? So you're going to use steady pressure on it. What you're looking to feel is for that muscle knot to kind of relax a little bit. You'll feel them underneath your thumb, the knot just kind of relaxes a little bit. Okay, that's what you're looking for. Now, if that doesn't happen, then we'll go to the next step, okay?
You get a hammer?
No, but do that first. See if you feel, find one of those trigger points that you just found, and use some pressure on it. And work on each other if you're gonna, huh? Yeah, I know, but that's not gonna be helpful for you to work on yourself.
That's it?
So, here, let me switch your chairs around.
Okay.
Oh.
Wait, I can get it. Geez, don't drag me, break the back.
So, I want you to put this chair, and you guys will switch chairs.
There it is. Right there.
Excellent.
Both ends are great.
Well, then you can try your ginger fist.
So,
Yeah.
until it, whatever you can push.
But you can find it. You can, you can try it maybe with one. Try with
Right,
this,
yeah.
and you can walk that one in like that.
Yeah, that's not a bonus.
I know, well, you find it with your finger and then treat it with your knuckle. Okay, so you're gonna find the spot,
And then you use this.
okay, and you're gonna, okay, so wait a minute. So you're gonna find the spot, and then you're gonna press, and you're not gonna press any longer than 30 seconds. You're not massaging it. You're not massaging it. You're pressing on it.
That's all you ever do is 30 seconds?
Yeah, that's all we're gonna do for now, yeah.
But when you do your therapy, it's longer?
If I don't get it to release, if I don't feel any kind of release in 30 seconds, then we'll go on to the next step. So you got one here.
Just press it, don't keep moving, just press.
Okay, so just release a little bit there. Now here's what you do. Here's what you're gonna do. Here's what you're gonna do if if you don't feel the muscle release after about 30 seconds, if you look up here, I'm gonna do this on Diane, okay? So say I locate this point here, and it doesn't release after about 30 seconds. What you're gonna do then is you're gonna do some cross fiber massage. Now, the muscles on the neck they go like this, right? Kind of go like this. The muscles don't run like this, right? They run like this. So you're going to use, if I got a trigger point here, and there's a big one right there, if I don't feel that release after I pressed on it, I'm going to use cross fiber massage. So I'm going to go this way and this way, across the fibers of the muscle, while I keep the pressure on that spot, okay? So that's cross fiber massage, and that'll be very helpful. Because this is like a knot in the muscle. You know, when you see a piece of steak and it's got the fibers and the muscle fibers in the steak. Well, if there's a knot in there, you can rub that steak, and it eventually will, line the fibers back up again. You rub the knots out. Sorry if you vegans here.
That's good.
We've seen those muscles.
Right.
So,
You feel like that?
Okay, so try that, 30 seconds. If it doesn't release, then you try that cross fiber massage.
Just put pressure on that, so we should push out.
Oh, yeah, if you feel.
It hurts, but it feels good at the same time.
yeah.
Yeah, it hurts so good.
This feels like.
Yeah, see it release there.
Feel that?
Yeah.
That's it. And then rub across these fibers like that.
So we would
You
be
get your
able to
thumb
do
on it
this
like that?
in on ourselves?
So we don't.
Well, if you're gonna do it on yourself, then you're gonna do it like
That's hard to even pronounce.
pressure. You get that back.
That actually hurts.
And then if you're on the spot, then you can use these.
Instead of hurt, actually, I'm not hurting. School.
Got it?
Yeah.
You're never gonna feel like this and use this one here like this to try and work that. You're gonna use this one to work this one, and this one to work this one.
Okay.
Yeah, it does. Just around my hand.
So that lady, before she left, she was wondering what the difference between massage therapy and this pressure point. Is it the same thing basically, or?
Well, you're working on acupressure points, so you can actually make a difference in the internal organs too.
Yeah.
That are associated with these different areas. We have to pick out some areas to work on, so these are the most accessible ones to work on. You can also work on the spine here.
How would that be different from massage therapy?
Is there anything right?
Massage therapy, they usually, depends on the kind of massage. If it's like a shiatsu type massage, then that's kind of like a lot of what this is all about. Shiatsu massages, massaging the acupuncture points. So you're looking more at points instead of areas. Massage is done on areas of the body. Massage the whole hamstring. We're looking at particular spots along the way.
Really? Yeah.
So, massage is very good.
Squat, tension.
Yeah.
Foot reflexology. Yes. Just go down to Books A Million
It's not
and
that bad.
went to the health section there, and you'll see foot reflexology. They got a bunch of them there. And this one really, just look for the one that you like the most, the one that seems the most user-friendly.
Does that hurt?
And one that should have some glossy photos.
So why don't we just get a vice? There, my neck hurts.
Okay, so we already did all of this. It doesn't release in 30 seconds. Then that's when you're going to, that's when you're going to start doing the cross fiber massage, right? So, you know, if you did the survey, most of you have done surveys before, and you have these acupressure points, and you have things that you check off on the surveys, then it indicates that, you know, there's some things there that you really want to have, you know, take a look at, right? Whatnot. So this part here, let's do this, because, yeah, I know. This is the part I said the chairs are going to be moving around here a little bit. So let's do this, because I think the rest of the workshop is a little bit action oriented. So you're going to move the chairs over to the side of the room. I want to keep a big open space here. Yeah, I want to open up the space. And drag these guys over here. Okay. Yeah, get rid of that chair. Pull the chair over there and get rid of that. And you're going to come up from the back of the chair. Okay. Give yourself a little bit of space. You got wide open space here in the middle, so somebody, you know. Okay. So we're going to do this one first. Okay. So you're gonna pick up just pick up your leg and just pick up any leg right now. Okay. All right, put it back down. You might want to take your hands out of your pocket, Glenn, when you put it down. Okay, now whatever leg you just picked up, that's the leg you're not going to pick up. Okay? What you're going to do is you're going to pick up the leg and close your eyes, and I'm going to count to 10. Ready? 1, pick up. Pick the other leg up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. So a couple of you got it. Okay, so you think that's important to be able to keep your balance when you have your eyes closed? You should be able to do that.
Yes.
You want to know where you are in space. And a lot of times you not being able to help keep your balance is because you're not getting information from your feet up to your brain about what is the position of my whole body in the world here right now. So, yeah, you can do it with your eyes open because
I can't even do it with my eyes open.
Okay, and that's a proprioception type problem. A lot of times people can compensate for that proprioception problem because they have some external reference points by looking at something. So if you can keep it balanced when you keep your eyes open and you close your eyes, then that's a problem, right? And that's a good point because you can't train your brain to make those pathways work the way that they're supposed to. It takes practice. And a really good practice is Tai Chi practice. Tai Chi practice is really great because you get to learn how to move with your head suspended from the sky by a string. So let's try that. Okay. Now what I want you to do when you pick up your foot, what I want you to do instead of trying to make yourself be balanced, I want you to imagine that you've got a string that's suspending your head from the sky. Just pick your leg up, suspend your head from the sky, and then close your eyes. Okay? It's better, isn't it? It's a little bit different. Yeah. So that's the thing. The thing about this is that if you can't do this, you can get better. You can get better at it.
That's cool.
Yeah. It's called plasticity. You can get negative plasticity in the brain, or you can get positive plasticity. Negative plasticity means that we keep on doing the same things over and over that are bad for us.
Neuroplasticity?
Yeah. Neuroplasticity. Yeah. or you can keep on practicing things that are gonna be really beneficial for you. It's like somebody that practices martial arts and they learn how to throw a perfect side kick. You know, they practice and practice and practice, and you know, they can't throw a side kick. It's impossible. It's not a natural motion to be able to throw a side kick. So, and after you do, you know, you practice for 5-10 years, you're able to throw a perfect side kick and everything is great. Now, for some reason or another, you stop practicing martial arts, and you know, it's 5-10 years later, and somebody jumps you in the alleyway, and you throw a perfect side kick right at his head. Right? You haven't even practiced for 5-10 years. Your brain has become plasticized to be able to make all of the neurons that need to happen, do that completely foreign, difficult movement like throwing a side kick. And so your brain can train, and it can train negatively, it can train positively. So you already did that. Can you touch the toes?
Hell no.
Okay.
Well,
All right. So.
they did.
Okay, good. Most of you are pretty good there. Okay. And this one here, this is a really interesting one. What you're going to do is you're going to march in place. Okay. Now, when you march in place, let me just show you first before you do it. You're going to lift your knees up like this. Okay. It's not like this. You're going to lift your knees up. Okay. But you're going to do it with your eyes closed. Okay. So I'm going to time you guys for about 30 seconds.
Are we doing 10 of them or 30? What?
I'm
Tell me to
gonna
stop.
time you for probably about 30 seconds. So close your eyes and start marching in place. Okay, stop, don't move. Okay, stop, don't move. Look at your feet. Your feet should be even. If one foot is in front of the other, and your hips are rotated a little bit more than they should be.
So mine are
If
screwed.
you look at where you were when you started, you were like this, and you finished and you're like this, and you have a rotated pelvis. It means it's like taking a rowboat with an oar and you keep on doing this.
Facing the opposite
Yeah.
direction.
I see that happen. I've seen that happen.
I
I've
thought I
seen
hit you
people
and I said, excuse me.
go like this and they're marching like this and
I've seen photos.
they're turning and they're turning all the way around like this and they open their eyes and they're, where the heck am I? You know? And that
What does
happens.
it mean? You have a what?
It means your pelvis is rotated.
Oh, nice.
You have a rotated pelvis.
So how can you fix that?
You can have chiropractic work done on it. You can have acupuncture work done on it. You can have different things done.
I lift your part. I mean, if my feet were like this, then something's wrong with the pelvis.
Yeah. Yeah.
I'm all screwed
I'm
up.
in a line. That's because we're sitting here.
Yeah. Yeah. There you go.
That's because we come here, right? That's because
It can be the bones themselves, or the ligaments tighten more tight on one side.
Could it be from a past injury too?
Yeah, past injury.
we're
So it's a good little test too. So just turn your head to one side,
Eyes open or closed?
open, and turn your head to the other side. Okay, was it easier to go to one side than the other? Yeah.
Yes.
Okay, so if it was easier to go from one side to the other, then you flunked the test, right? Because that means you have difficulty going to the other side. You should have equal range, you should have about 90 degrees of range of motion going from one side to the other. Should be okay. This is a good little test, and this is a test. What you want to do with this test is put your arms up so that they're about, the triceps are about parallel with the floor. Yeah, and then put them back a little bit more. And what you want to just pay attention to is, because this is diagnostic for us, okay? Do you feel any tingling in your fingertips when you like this?
A little bit.
A little bit? Okay, just hold it for a second. No? Okay. So if you feel like that, what you want to do is open and close like this first while you're in that position. Open and close, open and close. Just open and close. Okay, now what you want to do, okay, did that make it feel better or it didn't make it feel better?
Feels,
Made it
it
feel
feels
better?
warm.
A little bit better? Okay, if it felt better, then that's telling us you have a lack of circulation getting down to there, right? If it didn't feel better, then you got a blockage, you got an impingement that's keeping that from happening. Okay, so if it feels better, that's a good thing. Okay, so that's what these tests help us to find out if you have some kind of stagnation. And we all know what you're doing, you get a pebble in your shoe, right?
Yeah.
You have counseling. Well, you take a painkiller. That's what you're supposed to do, right?
No,
Okay. So,
wearing your shoes.
yeah, no, or that, yeah. There's always any excuse to buy a new pair of shoes. So that's the point. The point is you got something that's going on, you want to try and address it with the appropriate therapy, and you learn some beautiful tools here tonight to be able to really help some of those things. So I think, yeah. The gift is the opportunity, and a lot of you have already come and taken advantage of the gift, but I do want to throw it out there that if you haven't, then you have the opportunity to come down and sit and talk, and if you have any blood work, we can sit and talk about that, and I can give you my best take on what I think it's going to take for you to get what you want, where you want to get to. But I like doing this workshop because it really gives you some hands-on type things to be able to use to help yourself.
Tools.
Yeah. And it helps me if I'm working with you, I'm treating you, and you're able to do some things at home. It's a beautiful thing. You're gonna get better quicker. So take that stuff and use it and spread it around. It's great stuff. Go down to Books A Million, get a copy of the reflexology book, and have fun with it. Play with it. You can really have a good time with it. Foot reflexology is really powerful. I've seen profound differences happen you just using people's points on their feet. And when you want to spoil your buddy, it's a really good thing to just do each other's feet.
Got that?
Great.
Thank you. I can stand there without
I'll take care of them.
You just got this MRI thing, you want me to fax it to her or just put it on the desk? That's actually the results of what I just went
You want me to make a copy for you?
Yeah, well, I brought that for you, I got it.
Oh, okay, great.
So,
No, that's great.
I don't
Okay.
know if you want to put it in my file or.
I do.
Okay,
All right.
thank you, okay, thank you.
This is the first time I've had my sneakers on since 5:01. I stand better barefoot than just getting into these inserts in here.
Yeah.
So, and with without
Unique,
it.
just doing that little thing.
It's feeling better. Feeling better since